this room, we're going to do blockchain in healthcare and clinical research. And we have with us, well, you can say a four-letter word, Mike Henson, as well as Wendy Charles back. If you heard another session earlier as well, fantastic. So yeah, actually, without cutting into your time any further, Mike, Wendy, come on up, take us through.
Well, thank you for joining us. And as it says up there, we're going to be talking about blockchain in healthcare and clinical research. And some of the minefields that we need to navigate through, we're not going to have time in this to take a deep dive into that. But we wanted to spotlight what we think some of the real core issues are from a legal or regulatory standpoint. By way of brief introduction, I'm Mike Henson. I'm an intellectual property attorney at Perkins Coie. Perkins Coie is a national firm. We've got offices throughout the United States and 3 in China. I'm actually, one of the industry groups we have is the blockchain and the fintech industry group, which started in about 2013. We have on the order of 50 plus attorneys that work in this space throughout the firm in various areas, from regulatory, compliance, consortium consulting and things like that, IP. We also have, if you're interested, something called Coie, which is an app that we have that we update on a weekly basis to highlight some of the state and international initiatives in this space, and we really monitor a lot of what's going on, and it's updated, like I said, weekly. Wendy?
Hello everyone, I'm Wendy Charles, and I have a degree in political science with a specialty in health information technology, and I'm pleased to oversee the compliance of all the research at Denver Health. So we have to have a typical disclaimer, and so we are going to share our own opinions in this presentation, and these do not necessarily reflect the opinions of our employers.
We'll flip it out real quick. What we thought might be a way to just set the stage here is to create a fictitious scenario of a company, the Apple Corporation, that's going to design a wearable product that is going to collect health-related information from the users, heart rate, ketones, blood pressure, whatever you think that might be. So you can imagine a wearable of some kind that might interact with a smartphone, okay? And so in order to do that, they're going to have certain consumers that need to consent to the collection of this data, and they're going to have to deal with all the issues around that aspect of it. And as part of our scenario, you can probably imagine you'll have the consumers that need to get consent. They're going to work with a clinical research agency to use that data for their own clinical research. You might imagine also that the consumers are going to want to share their personal information and that health data with their own doctor. So let's just imagine a consortium of players here that deploy a blockchain to share all of this information. What are going to be some of the implications when they do that? We'll assume that our company is headquartered here in Colorado, but not everybody they're going to collect the data on is, and they might get some exposure to some other areas along the way geographically.
So starting out with our fictitious example, let's assume that the patient participant would like to provide consent to agree to share their wearable information as part of this project. And so some of the first questions we need to ask are, how will you establish the identity of individuals who agree to participate remotely, where you don't have a face-to-face interaction, they just sign up online? And as another consideration, how will you verify the age of majority? So one strategy to consider for determining identity is to use a risk-based approach. And this means that the more risk that the participant will face, either for privacy or for physical risks, the more effort you should put into in order to establish their identity. I personally use a graph that I got from eGov, but it's also consistent with the requirements for HIPAA as well as the FDA, where each step in this requires additional efforts. And just to give you an example, I recently signed up for an edX course on cryptography, and in order to participate, because the lecture was export control, Just to take an online course, I had to show an image of myself with my camera and hold up my ID, and it had to be verified before I could continue. It's just an example of strategies to verify identity.
And if anybody's ever traded coins on Bitrix or Poloniex or some of those platforms, you have to do the same thing.
And anyone who agrees to participate in line and is executing some type of agreement must be of the age of majority in the jurisdiction in which they are participating. And so some say, oh, I'll just have a click box to have people verify that they're 18. But that is not necessarily correct, because 5 states and also 6 provinces in Canada have an age of majority higher than 18. Some of these participants could be emancipated as well. And just as an additional consideration, remember COPPA. That's the act, it's the Children's Online Privacy Protection Act that has additional protections for people 13 and under.
So we're going to talk about what constitutes legal electronic signature, and if we're going to be collecting data, we have some laws here in Colorado that we need to be aware of, as well as some laws in other jurisdictions that we've talked about in some prior panels. So let's start with the first one. These are well established. They've been around for a while. There's basically 2 that are basically the ones that validate the legality of electronic signature, just as if somebody was signing it in ink. And the key things that you want to remember in these, and if you've ever done DocuSign, this is what's really going behind the scenes there. But you got to make sure that you have the consent with the person to transmit things electronically, to do it that way. You have to provide your disclosures to them. When you obtain the signature in the record, you need to maintain the association between that information, so that either party can pull it up at any time. They're entitled to have it and to maintain that association. So you have to do that. You also have to retain it for that purpose, and you have to explain how you actually went through the process of getting all this up. But just remember that if you've ever done DocuSign, I'm sure we all read everything before we click OK and accept. That's a lot of what's going on in those. So the big thing is to clearly show intent. And in addition to that, we have some FDA requirements.
If you happen to be doing FDA-regulated activities such as data collection that would be submitted as part of an application, the FDA itself in 21 CFR Part 11 has very specific requirements for what must constitute an electronic signature.
So the act I was just referring to, the Consumer Data Privacy Act in Colorado, went into enforced last year, September of 2018. The main thing is you got to have a written policy about what you're going to do when you're collecting information on Colorado residents, and you've got to take the reasonable steps to do it. There are, depending on the number of, if there's a violation or a breach of it, and depending on the number of residents that are implicated, either less than 500, less than 1,000, things like that, determines who you might have to report the breach to and things like that. So you can imagine, it's a new law. What are going to be the reasonable steps? What does that mean in this context? So the law is going to have to evolve as to what that does. So courts are going to deal with those issues. We have probably have some case law in other contexts, like non-disclosure agreements, where you have to take reasonable steps to maintain the confidentiality of the information that parties are sharing. So we can have some guidelines already on what that entails, but you can probably imagine this is going to have to flush itself out as time goes on. And under the Colorado Act, basically you're collecting personal information when you are collecting at least somebody's first name or their first initial, their last name, and one of these other categories, at least one of those. That triggers whether or not you are deemed to be collecting personal information under the Act.
So then in the next step of our fictitious example, the information is going to go to a research institute. And so there are some critical questions that you would need to ask in order to ensure compliance for the research piece. So the first is, will you need institutional review board approval for the research? Now, an institutional review board is an ethical review board. It's composed of scientists and non-scientists, men and women, some people affiliated with the organization, some not, and they review each research study to determine appropriate protections for human subjects. The second part pertains also to the first about which regulatory agencies will provide oversight, and that depends on funding and the type of activity being performed. So it's important to know that each regulatory agency has different requirements for IRB oversight, as well as different regulatory requirements. Under the first bullet point for Office of Human Research Protections, this type of regulation for human subject research involving health research is required whenever you are conducting research that is either conducted or supported by the Department of Health and Human Services, which contains all of the NIH research. If you are also conducting research under the FDA, this may be drug or device research that's going to be submitted as part of an application to submit something investigational so that you can get approval for marketing. But it's important to know that the FDA also has requirements for databases. It's not just about how the data integrity is protected. It can include electronic requirements for electronic signatures, as we noted earlier. The FDA has increasing number of requirements for how code sets are developed, as well as requirements for registries now. So if planning to do anything FDA regulated, there are additional requirements. And states are increasingly listing research requirements in their state statutes. And some states like California and Massachusetts have additional requirements above and beyond what is required for federal regulation. Oh, it's me. So when the information goes to a healthcare or a healthcare information, a healthcare organization is involved, and it can also be a health plan or a health clearinghouse, there are protections for health information. Now, I know that you're familiar with HIPAA already, but it's worthwhile to mention it's 2 A's, not 2 P's in the acronym. It stands for the Health Insurance Portability and Accountability Act. And it doesn't cover all health information. So when considering whether this applies, first of all, it's only to covered entities, and those are the healthcare providers or organizations, health plans or health clearinghouses, and it only applies to those 18 categories of information that are believed to be individually identifiable. Now, some are obvious, like name and social security number, but other categories of protected health information are not as intuitive, such as license plate or biometrics. So this information is protected under both the Privacy and Security Act and security rules, and there are many, many stringent requirements for both. The High-Tech Act, in my opinion, is an acronym that's misnamed. But it was enacted in 2009 as an amendment to the Social Security Act, where the government provided incentives for healthcare organizations to implement electronic health records. But a really key provision of the High-Tech Act is that all of the requirements to follow the HIPAA privacy and security rules were now extended to business associates. A business associate is any individual or organization that acts as an agent of a covered entity to either collect, process, or store protected health information on behalf of the covered entity. And so all of the requirements for the privacy and security rule must be covered by this business associate, and many blockchain hosts may fall as business associates. Among the many, many activities that a covered entity or a business associate must do in order to ensure appropriate protections, here are just some examples of additional activities. And this is a joke about how the omnibus rule is tough on business associates, because in the 2013 omnibus rule, which is the latest implementation of HIPAA, the Department of Health and Human Services greatly increased the fines for infractions of HIPAA.
So let's just talk a little bit about, let's tie this back into our blockchain scenario of deployment. So you might imagine an deployment environment with all these players where you have the doctor, the clinical research, the consumer who's sharing information. They might, let's just say they have a Hyperledger Fabric implementation with some off-chain stuff, because not everybody's going to have visibility into everything, but they're going to have to deploy a network. And in the Hyperledger scenario, and in a lot of these proprietary blockchains or others, people are going to have certain roles and rights and permissions. You know, in the Hyperledger, you have the endorsers, the orders, things like that. Depending on how that all plays out, are these which or more of these individual participants are going to be deemed a business associate that now implicates all this HIPAA stuff and everything that Wendy's been talking about? And how can, as the attorneys, how do we help advise people deploying those environments of those issues, and maybe how to reduce the shades of gray, maybe navigate around some of those?
I'm going to add too. When I interact with software vendors, they often promote their product as being HIPAA compliant or GDPR compliant. It is important to know that there is no such thing. Only covered entities can be HIPAA compliant. Software can only meet typically the technical safeguards required of the HIPAA privacy and security rule. But there's so many other things that the covered entity needs to do, such as write policy and provide training and provide risk assessments, that no software or technology by itself could ever be HIPAA compliant, GDPR compliant. There's so many things that the covered entity needs to do.
So we've had several people talking about, we have a couple slides on California Consumer Protection Act, CCPA, and GDPR. We're not going to go into those so much. I'm going to try to tie it back into this scenario because people have been presenting on this. But just keep in mind that if you have some of your consumers that are the health data that's being collected, they're California residents, for example, or you have part of your organization or part of the infrastructure, maybe some of your nodes are in California, you might implicate this act to the extent you meet the other threshold requirements of revenue and how many people you're touching and things like that. But just to take an example, you know, if you're deemed to be doing business in California under this act, you have to be careful not to, when you sell or you share people's private information. Well, what does it mean to share information? Let's say you have 500 nodes are sitting in California and they're not doing anything but passively sitting around, but it's a distributed shared ledger. Are you going to be deemed to be sharing information about people because it's stored there? Those nodes are in California. So you have to just be aware of these kinds of things. Maybe you strategically place nodes and roles in certain places to try to eliminate some of these issues. Our firm is, with GDPR in the last year and a half, and now with this is going to be enacted in January of next year. We have attorneys that have been immersed in advising our clients, whether they're blockchain or not, but specifically blockchain-related clients on exactly these issues and how they can, you know, set forth their policies to best address all this kind of stuff and design their infrastructure in light of these laws. Because they weren't designed with traditional data models in mind, they're like blockchain. So it's a different paradigm. So, and again, we've all talked about GDPR, but you know, again, where are your consumers? Where's your infrastructure? These things may or may not be implicated depending on where they are and what they're doing. So obviously, you need to plan appropriately. This is kind of redundant, aren't you? So identify what the roles are that people are doing. Plan your data. Another thing to keep in mind: laws change, infrastructures change, corporate policies change. You don't just wipe your hands of this once it's done. You've got to revisit this and audit these things periodically to make sure that you're in compliance or doing the best you can to avoid pitfalls. Updating privacy policies, things like that.
I can also add that if you do research in California or the European Union, there are exclusions for research aspects. And GDPR also has exclusions for public health surveillance. So as long as you document how you are using the residents' information, you might actually fall into one of those exclusions and not have to follow all of the provisions as they are written.
So let me just some quick takeaways. Go ahead.
Yeah.
To wrap up here.
So we just want to wrap up and remind the group, we could only provide a brief overview of what to be aware of, but we're just trying to raise awareness about what we call compliance by design. That if you are planning your blockchain solution and you are going to encounter any of these scenarios, we just want you to think ahead about what you would want to have in place to ensure that you're compliant. So starting out, you saw that there are many legal and regulatory considerations.
Data, you know, big data is everything. Where's the data going to be? It just goes to the same point. Understand your infrastructure, understand the laws, and consult with people that can help guide you through this to the extent you can. It's just, it's good business practice for sure. Because there's a lot of laws out there that are going to change, and a lot of these haven't even been addressed on what some of these are going to mean. We don't have the benefit of a long history as to how these get interpreted. So it is a moving target in that respect as well. So you got to be abreast of those changes.
Agreed, and make sure that you document how you are following each of these laws or regulations so that you can show your due diligence and questions about that. So if you have any, if you are encountering these situations, please do reach out to Mike or me afterwards so that we can possibly help. What kinds of questions do you have? Yes?
I saw that one slide which connected, if you have information on your client that has their first name and last name, connected with a bunch of data, such as medical records. So I'm curious from a compliance issue, we constantly in a workers' comp space have to be compliant, order to be compliant. We never saw the information. If that information was stored elsewhere, if that information was a link to somewhere that we don't necessarily know anything about, do we have to report on something like that?
Why don't you repeat the question?
Well, I think it goes to what is the nature of the information that's being kept, and how readily can it be used to identify somebody, and where is it being stored? And believe me, if you want a black and white answer to something like that, it doesn't exist. But what you can do is, a lot of things when it comes to the personal information, to the extent it's not readily identifiable, is it something that is related enough to personal information that somebody could walk down the path and ultimately understand what the information is based on the manner that it is kept, and connect the dots, if you will. As far as storage, one of the things you can do, and we've talked about this before, is store personal information maybe offline because of the immutability of the ledger. Because if to the extent it changes, or somebody wants to remove themselves or update their address in your system, you can avoid that. Maybe store a hash of the information on the ledger, but store a lot of that personal data elsewhere. Lock it up under lock and key, and keep it controlled in that environment. Determine which of these participants in your blockchain are going to have access to that, like their permission. It's just, there's not always a black and white answer, and when there's not, it's can we reduce the shades of gray in this and just kind of do the best we can under the circumstances based on what we know.
One thing to note about the Colorado Privacy Act is that it requires that a breach be reported to the affected residents within 30 days of the breach. And that is a far shorter time period than we are accustomed to with HIPAA, which is 60 days. So just make sure that you have policies and procedures in place for how you will rapidly respond and how you may notify those affected individuals about a breach.
I think Hans just said California is 45 days. I believe that is correct.
So what if we go to the level of what do you feel, or maybe do you know any examples of liability for designers of software and designers of wearables and then make them for another company? So usually designers have identity clauses in their contracts, but they're very short. It's one paragraph. Do you know of any examples where the designer's been hit by some of this stuff?
There have been very few examples where people have been hit. I think really the only thing I'm aware of some stuff going on under the GDPR. There have been some initial people getting popped with things like that. But I would think of addressing it exactly what you said, through an indemnity arrangement, so that you can at least try to protect the designer of that kind of stuff. Because at the end of the day, they're not the one collecting the information. It's a product that they provide under a service agreement that collects the information, and somebody controls the use of that product. So I would think the designer's largely insulated from that. But indemnification agreements are certainly a good way to, belt and suspenders approach.
I will also answer that question from the perspective of a healthcare organization. A covered entity is ultimately responsible under the Department of Health and Human Services, and the Office for Civil Rights, which is the enforcement division for HIPAA, has been citing covered entities when they have not taken appropriate actions to verify that the vendor's software programming has been accurate. And you've probably seen, last year there was a vulnerability in some of the Cerner electronic health records where they were calculating billing incorrectly, and the hospital was deemed liable. So just be aware that there can be exceptions.
Thank you.
Just a quick question. The promise of blockchain is to improve business processes. And my understanding is if you're doing a process improvement, you don't need an IRB. Is that still correct?
That is correct. It would not be classified as research. But just be aware that there is some overlap between quality improvement and research. It just depends on the degree to which you would like to generalize the information beyond the entity that's conducting the quality improvement activities.
Last one here.
I had a quick question. As a consumer, I'd always like to know a lot more about what everybody else knows about me, including the Googles and the Facebooks and foreign governments and bad guys. So would it be in my best interest to create my email with my first name, middle initial, and last name, so that every time I do any kind of transaction, I can compel everybody to give me within 30 days all the information that's pertinent to my having an information breach that they perpetuated by the fact that they now have my first name, middle initial, last name, and my email address, which is exactly that at Google or gmail.com.
That's brilliant.
Well, if I was in a deposition, I'd object because it calls for speculation as to what's in your best interest. It's a compound question, but I'll let Wendy field it.
A breach is an unauthorized disclosure of your personally identifiable information. And if you create your email address that way, it's not necessarily unauthorized.
That's a good thought.
I like that one though. Kind of plant it in there so they have your information, then they have to tell you everything they know about you. Well, can we have a round of applause, please? That was a great session. It's hard to believe after all this fun that there's more to come, right? Yeah. All right. Yeah. And this mic probably will keep acting.